A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.
The American Medical Association now considers obesity to be a chronic disease, and the Center for Disease Control and Prevention says it's a national epidemic. Nearly 35% of Americans are obese. Today we find out it's not just overeating that's leading to the problem. Genetics, long-term lifestyle choices, psychological issues, and many other factors are preventing people from achieving weight loss. Weight loss surgery, also known as bariatric surgery, can provide long-term solutions and healthy weight loss through changes to their digestive system. Does it work? And is weight loss surgery right for you? We'll get the life-saving information you need on this edition of your Hometown Health Connection. I'm Samantha Latshaw. Welcome to your Hometown Health Connection. Joining us is Dr. Mark Cavaretta from Trinity Medical, Western New York. He is a board-certified surgeon who specializes in bariatric and general surgery. We also have Dr. Bala Thatigotla from Trinity Medical, Western New York. He is a board-certified surgeon who specializes in bariatric, advanced laparoscopic, and robotic surgeries. Doctors, welcome. Thanks so much for joining us.
Thank you.
Thank you.
Dr. Cavaretta, can you tell us about obesity as a condition?
Obesity starts when the person's body mass index is 30 or greater. And I think the best way to look at obesity is to view it as a chronic disease. Chronic diseases tend to be progressive and relapsing. This way we can evaluate, treat, and manage it, and hopefully prevent it as a chronic disease. And in addition to this, unfortunately, obesity has become a global pandemic. Currently, in the United States, it's estimated that 40% of the adult population is considered to be obese. And we think that possibly, if this trend continues by the year 2030, possibly 1/2 of the adult population in the United States.
Well, that is a staggering statistic, Doctor. Now, can you describe what candidate would be a great candidate for weight loss surgery?
Well, if a person's body mass index is 40 or greater and they're cleared for the surgery, they will qualify for the surgery. If they weigh a little bit less and their body mass index is 35 to 40, they need to have at least one other obesity-related comorbidity like diabetes, high blood pressure, high cholesterol, or sleep apnea. They must be medically cleared for a general anesthesia surgery. Contraindications to the surgery would include a body mass index less than 35. If a person's less than 18 years old, we won't operate. If a woman is pregnant, or if anybody has any smoking, illicit drug, or alcohol abuse issues, unfortunately we cannot operate.
Dr. Bala, now the body mass index, the BMI charts, we've all seen them before. They can be a bit confusing. If someone is, let's say, 10 or 20 pounds overweight, is that really considered obesity?
It's a good question. If the numerical number of 10, 20 pounds can be confusing because for some people, if they're excess by like 50 pounds, it can be morbid obesity. For some people, it may not be. To avoid this confusion of the numericals, the National Institute of Health has come out with this formula called body mass index. Once individual knows their height and their weight, and it's a formula, once the bunch of free online calculators are available. Once you enter your height and weight, you'll get your body mass index. I think a body mass index is a better way to compare and define the person having this health problem called obesity, versus just throwing up a number of 10 to 20 pounds.
That's helpful. Yeah. So using that formula of height and weight.
Weight.
Now, so what would you consider normal or an abnormal BMI?
I mean, typically like when the body mass index is between 25 and 29.9, we call it overweight, and 30 to 34.9, it's obesity. And then from surgical world, BMI of more than 35 and above, we call it morbid obesity. The reason why we call it morbid obesity is because once the BMI goes beyond 35, the research has clearly shown there's a significant increase of incidence of complex health problems, including cancers. That's why we call it morbid obesity. That's a subset of individuals who are eligible for surgical interventions.
Thank you for clarifying that. I'm sure a lot of people at home are confused about
absolutely,
that.
Yeah.
Now, Dr. Cavaretta, why does excess weight have such a detrimental effect on people?
Well, one way the excess weight can have a detrimental effect is just the mass effect that the weight has on any body system or organ that you can think of. So it can cause mobility problems, joint pains, chronic back pain. The heart can suffer with something called congestive heart failure, and which can cause edema and swelling in the lower extremities. Things like shortness of breath. And one of the most common conditions we see is obstructive sleep apnea, where patients require the bulky CPAP and BiPAP machines. We also see things like urinary incontinence and some degree of kidney failure. That's one way it can affect it. The other way is it can have a metabolic effect. Think of that as the obesity changes the chemistry of the body. So this can lead to insulin resistance, which can lead to diabetes, other conditions like high blood pressure, high cholesterol, and in some young females of childbearing age, it can cause something called polycystic ovarian syndrome, where the hormones that can normally control the menstrual cycle can be unregulated, and young females are unable to get pregnant.
Wow, that really is a domino effect for throughout the whole body. Dr. Bala, what do you typically see in patients who come into with a desire to undergo weight loss surgery?
One common thing I hear when the individual come for educational seminar or for consultation is, "Doc, I want my life back. I want a quality life back." That really tells me that they underwent so much of stress and struggle in dealing with this health problem, not only physically, but mentally as well as from a medical standpoint. So most of them are very committed to seek for help. And that's where we are here as a part of Trinity Western New York Bariatric Surgery. We're here to help the people suffering from this health problem.
Absolutely. Your quality of life is everything.
Yeah, absolutely.
Now, some people at home might be watching this and thinking that, well, weight loss surgery, that's the easy way out. That's a cop-out to skip out on diet and exercise. What do you say to them?
I mean, that's a wrong notion. I get asked this question when I give the patient educational seminars. I tell, this is not easy route. I would say this is like committed route. You got to be committed for this for your lifetime. The easy part is my part. I do the surgery. I've done several, I would say thousands of them. Been doing it for like a decade now. The difficult part is your part, because you got to be committed for it. Unless you show the commitment for the surgery, the individual won't be successful. So it's not an easy route, but it is the best route that is available to regain the health back and to get the better quality of life. And overall, the life is going to be new life.
Absolutely. Yeah. It is a mental and physical commitment.
Yep.
Now, would you say that obesity is caused by a food addiction for some?
It's part of the reason, part of the contributory factors. When you look back at scientifically as well as social factors, we use the word, it's multifactorial. It starts with genetics. Genetics actually load the gun, and environmental fires the trigger. We are all born with some genetic setup. Some people are predisposed to develop this health problem. On the top of it, environmental as well as our personal factors like food, eating habits, they do contribute for it. So you brought up a very key point there, food addiction. We got to be cautious whom we offer the surgery. As a part of this, we do have a comprehensive preoperative workup, which includes psychological workup. If our psychologists or psychiatrists identify that somebody has this food addiction problem, we would like to be optimized or treated before they move on to actual surgery.
That's a very important step
Yep.
in the process. Now, Dr. Cavaretta, you use cutting-edge technology at your practice. What are the different kinds of surgeries available, and which do you perform?
In 2013, the sleeve gastrectomy became the most common weight loss surgery around the world, and it's the most common one that we perform. It involves just stapling across the stomach and removing about 70 to 80% of the stomach. The gastric bypass is still around. It's done a little bit less now. That involves creating a very small gastric pouch, maybe like the size of an egg, and it also involves rearranging the intestine to produce some malabsorption. The third most common type of bariatric surgery now is actually revisional bariatric surgery. For example, a sleeve gastrectomy can be converted to a gastric bypass. The gastric bypass itself can be revised by changing the length of the small intestine that was initially created. Lap bands, which you don't hear about so much anymore, can be removed and then converted to either a sleeve or a gastric bypass. And then sort of the least performed surgery, which can be a very good operation for certain patients, is the biliopancreatic diversion duodenal switch, which is sort of a combination of the sleeve and the bypass. And yes, we do use cutting edge technology. All of our operations are done minimally invasively. That means either laparoscopically or robotically with several small incisions. Usually it's about 5 centimeter or less incisions. Laparoscopically, the patient is at the operating table controlling the instruments directly. With robotic surgery, the surgeon is sitting at a console. He's controlling the robot, which is directly moving the instruments. The advantages of the robotic surgery include seeing the anatomy in 3D as opposed to 2D with the conventional laparoscopy. And the instruments with the robot have 7 degrees of freedom versus the 4 degrees of freedom in the conventional laparoscopic approach.
Now, there are pros and cons to everything, doctor. What are the risks, and has anyone ever died from these surgeries?
There are risks to any operation that involves general anesthesia. There can be cardiac risks or respiratory complications. There's always a small risk of bleeding and things like blood clots. And then there are risks that are particular to the type of surgery. For example, with the sleeve gastrectomy, a small percentage of patients may develop some heartburn or reflux symptoms. That's usually controlled with a medication. Leaks are probably the most feared complication. Fortunately, that happens very rarely. The same types of risks are involved with the gastric bypass. Though with the gastric bypass, there can be some bowel obstruction and something that we call an internal hernia. Again, these are very, very rare, but possible. And we've come a very, very long way in bariatric surgery. When you look at current reports about death or mortality, it's somewhere in the 0.2 to maybe 0.6% rate.
Dr. Bala, how important is exercise both before and after surgery?
Exercise is a key component. For the surgery will change the body metabolism, and also exercise actually works like a component for it to take on the journey further. And also exercise helps. We actually make the individuals to go through the pre-operative exercise process as well. We call this as a prehabilitation. We actually making the person to go through this process so that the recovery after surgery will be smoother for them. They know exactly what to expect, to change in their body balance, to do exercises safely after surgery. The research has clearly shown the average individual, especially after surgery, they need to be participating at least like 150 to 180 minutes of exercise activity per week to maintain the weight loss and also to prevent the weight regain. So it's a complementary to the surgery. So it's a very important component of long-term success.
Absolutely. And how soon do you recommend for them to start the exercise routine?
I mean, there are 2 ways. Immediately following surgeries, actually, like I do surgery in the mornings, in the afternoon when I go to the floors, I would expect my physical therapist will be working with the individuals. They'll be walking on the floors. I tell people just do what's comfortable for you. But regarding lifting weights, and some of the physical activities needs like exertion or usage of core muscles, we encourage them to wait for 3 to 4 weeks. Again, as a part of our preparatory process for the individuals to undergo the surgeries at Trinity Western New York Bariatric Surgery, the physical therapy group is closely involved with the patients, right from the perioperative process as well as post-operatively. They'll receive that education, what are the things needs to be done, which will be done in a phased and a graded manner after surgery. But in summary, by the end of the 4th week, they'll be doing almost all the stuff which they were doing prior to the surgery.
We will have much more on obesity and weight loss surgery. But before we cut to break, a reminder that you can connect with Dr. Mark Cavaretta and Dr. Bala Thatigotla from Trinity Medical Western New York at one of their many locations. Their phone number is 716-893-0333 and online at Trinity Medical WNY.org. Ahead, what are the risks of unwanted side effects of weight loss surgery?
Buffalo Healthy Living magazine is a free, full-color magazine distributed throughout Western New York. Now, more than ever, as we all want our families and friends to be safe and well, Buffalo Healthy Living magazine is devoted to health, fitness, and nutrition for people of all ages. It's a great read and also has great recipes. Pick up Buffalo Healthy Living magazine all over our hometown or go online anytime at buffalohealthyliving.com.
In June of 2019, I had the biliopancreatic diversion with duodenal switch. I've lost 140 pounds in total. I am 22 months post-op. So I have struggled with morbid obesity actually since childhood. I've multiple times I had lost weight, but only to regain it shortly after. The year before I pursued surgery, my blood pressure was uncontrolled for multiple years. I had constant back pain that could only be caused by my weight. And it was just a debilitating constant cycle I couldn't break until I'd gotten weight loss surgery. Then I've actually been able to get to a healthy weight. Anybody who is out there that is struggling with their weight and health issues, I would definitely suggest considering looking into it. It's definitely a personal decision, but I know that I would have never been able to be this successful on my own without this help.
Welcome back to your Hometown Health Connection. I'm Samantha Latshaw. We are continuing our discussion about weight loss surgery with Dr. Mark Cavaretta and Dr. Bala Thatigotla from Trinity Medical Western New York. Dr. Cavaretta, how much weight do patients typically lose, and do patients regain the weight back?
With the amount of weight loss seems to depend on the type of surgery. It's the best way to, or the most common way to track weight loss after surgery is in terms of what percentage of their excess weight did they lose. The excess weight is how much above their ideal body weight that they started out with, and then what percentage of that excess weight they lost after the surgery. For example, with the sleeve gastrectomy, after 2 years, the average weight loss is about 60% of their excess weight. For the gastric bypass, it's about 70 to 75% of their excess weight loss. And with the biliopancreatic diversion, that's in the neighborhood of maybe 75 to 80% of their excess weight loss after 2 years. It's actually normal for patients to regain a small amount of their weight as the years go on. It's extremely rare and hardly ever seen where a patient will regain all of their weight. It's not impossible, but it's very, very rare. And then there's about 20% that will regain a little bit more weight than what was expected. If that's the case, the best thing is to come back to our practice. We have a metabolic wellness center where they can see dietitians, exercise therapists, mental health counselors, and sit in on support groups. We're usually able to solve the issue this way and hopefully get the weight loss back down.
Dr. Bala, does a patient have to go on a diet prior to surgery, and what does that diet actually consist of?
Yeah, so again, the research has shown that if somebody can demonstrate some weight loss prior to surgery, that subset of individuals have been very successful after surgery also. So losing some weight helps in 3 different ways. Number one is it kind of gives introduction to the individual to actually understand the life after surgery. Number 2, it makes the surgery technical a little bit easier, and the complication rates are much lesser in the individuals who has demonstrated some weight loss prior to surgery. Number 3, it's a test for the patient compliance. That means whether the person can judge themselves whether they can sustain this lifestyle after surgery. So it's important for them to understand that.
Absolutely. And what about after surgery? What type of diet do they have to follow?
There's a strict diet guidelines initially. In simple terms, I tell individuals we all need to learn how to eat. The same thing happens after surgery. They got to learn how to eat slowly, small quantities of food. Immediately following surgery, we actually design the diet progression in different stages. We call it the 5 stages. Just to sum up, immediately following surgery, they start on a clear liquid diet, and then they go on to full liquids like protein shakes, and they eat like a baby foods for 1 or 2 weeks, and they go to soft diet and then regular diet. From the time of surgery to the time they eat regular food is about 6 weeks. The other common question I tend to get asked is, Doc, I like this food, but this is absolutely healthy. Will I be able to eat it after surgery? Absolutely. The goal of the surgery is to give you back the healthy life, not to take away the healthy things which you're doing before. It's just the way the person eats has to change. Small quantities of food, chew it well, swallow it. That's mantra for it.
Right. Some people actually forget that very important step to chew your food well, right? That actually has a huge effect on your system.
Yep.
Now, what about removing certain things from your diet, like alcohol or perhaps even like real fatty foods that might be harder to digest?
Yeah. So again, the preparation starts before surgery. Again, we have a nutritionist team who are closely engaged with individuals right from the process, much before surgery. They educate them about healthy eating habits, cutting down the carbohydrates, increasing the lean protein, cutting down the fats, and they actually customize based on the person's regular day-to-day activities. Nutritionists will be working closely with the individuals. And the post-operative is very important when somebody is trying to lose weight. Cutting down the carbohydrates, maintaining the lean protein is very important so that you don't lose the muscle mass. And also, it's important for the individuals to understand to supplement their nutrition in the form of multivitamins and other supplementations so that they don't develop any deficiencies that can be contributed by the surgery.
Dr. Cavaretta, what are their recommendations regarding pregnancy after weight loss surgery?
Well, it is safe to have a pregnancy after the weight loss surgery. However, the global recommendation is to wait somewhere in the neighborhood of 12 to 18 months after the surgery to become pregnant. This gives the woman a chance to reap all of the benefits of the weight loss surgery, to lose the maximum amount of weight, and to have whatever obesity-related comorbidities hopefully improve or even resolve. And this should make having the pregnancy safer. Obese women that become pregnant, there's an increased risk of complications. In fact, it is thought that maybe up to 1/4 of all of the complications that happen during a pregnancy can potentially be traced back to the obesity of the woman. Obviously, she should check with her OBGYN. Laboratory work should be done to make sure that vitamin levels are correct, and electrolytes and elements are also as normal as possible before the pregnancy.
Dr. Bala, are there any unwanted side effects a person can experience after the surgery?
The risks of the surgery obviously are much lesser than most commonly performed surgery. We have most recent, one of the largest publications came out in a journal of obesity. It quotes back the population of about just people who underwent about 209,000 surgeries. Of these, if you look back at the data, somebody experiencing the unwanted side effects we call as complications, whether minor or major, is less than 3%. It's much less than most commonly performed surgeries you can think of, like name some hysterectomies or joint replacement. It's much safer than we can think of. Again, the technology has evolved. The training has evolved. We use the cutting edge technology in terms of high risk people. We use the robotic technology, which makes these unwanted side effects to be very minimal and much safer. And also, it's a comprehensive approach. Not only us, we do have a full set of team who are helpful, like in terms of nutritionists, physical therapy teams, endocrinologists, other medical experts as a part of our team who really closely follows these individuals before and also after surgery. We do offer support group meetings also, so that if anybody develops any of this unwanted side effect, we just try to address it at earliest stage. But overall, in summary, the surgeries are much safer than most commonly performed surgeries.
What about plastic surgery for those who have a lot of excess weight in the weight loss?
Yeah, not everyone needs this plastic surgery. Approximately, I would say 4 to 6% of people might require. The good thing I tell individuals is the skin is very elastic and is healthy collagen. As long as you keep up the nutrition with the nutrition supplementation, work on with the physical therapy teams to tone up the muscle, tone up the skin. A lot of times you'll be surprised the skin will get tucked in. Not everybody needs a plastic surgery. But again, this is not a blanket statement. Each person is different. Their needs are different. Their body mass index might be different. So we educate the individuals to wait until 18 months. By then, the weight loss will be a little bit more plateaued, and then seek the consultation by a plastic surgeon for that.
Dr. Cavaretta, what about mental health? How is that affected for some?
There does seem to be a tendency for depression to resolve and for self-esteem to improve after the surgery. Patients often feel much better. They have improved quality of life. They often become a little bit more social after the surgery, and all of this can help to improve some of the impression anxiety that they may have had before the surgery.
Now, to both of you, this is a very important question. Many people are listening in and perhaps thinking, is this covered by insurance?
Yes, this is most insurance companies do cover. Again, the criteria are the person's body mass index has to be 35 to 39.9, at least with one obesity-related health problem. Or if the body mass index is more than 40, even if somebody does not have any health problems, most insurance providers do cover. But obviously, we encourage individuals to check with their insurance companies, make sure their plans do cover the surgeries, because there are some riders by the insurance companies where they will exclude this kind of surgeries. But most insurance companies do cover, but again, it's always better to check with insurance companies.
You can connect with Dr. Mark Cavaretta and Dr. Bala Thatigotla from Trinity Medical Western New York at one of their many locations. Their phone number is 716-893-0333 and online at trinitymedicalwny.org. Obesity is a chronic relapsing condition, which means that surgery does not cure obesity. It's just part of the treatment. Turning to a surgical solution to solve a weight problem is a big step. The team at Trinity Medical Western New York will help you manage your obesity long term so you can live a happier, healthier lifestyle. I'm Samantha Latshaw. Thanks for watching. Stay safe and be well.
A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.